for you guys when you go over for your hospital rotation, and I'll go into more detail about that. So attendance, of course, for your lectures, it used to be mandatory. Now is just your own responsibility to make sure that you view all the online lectures in time to ask any questions that you need of your lecturers. Hospital block is a mandatory portion. You cannot not show up to it. I will go into details of what, any times that you have an exception to it. And there will be 2 exams. We'll kind of go through a good chunk of the lectures and then have one exam towards the middle of the semester, and then you're going to have another one at the end. And that is all outlined for you in the schedule. We have the schedule set up until that December time when you get your first exam, and then you'll get the remainder for the spring portion soon. So, for the hospital rotation, you, as I said, are supposed to show up to your week, which is already blocked. Mill Boyd should have blocked your Axiom schedule so you know when you have the rotation. You also get an email the week before from Maureen with reminding you of where to show up, what you need to do, and all of that. You are excused from your lectures and your labs during the week rotation. However, if you have an exam or a translational conference, you have to go to the exam or a translational conference. The hospital block is not an excuse for an exam. What we do ask for you is that if you have an exam, let's say it's at 1:00, you don't just skip the whole day of hospital block. You actually go in the morning and then just go to your exam, go do your exam. I know everything's online now. So if you want to go back to, your place or the dental school or wherever it's comfortable for you to sit down and log on and take your exam, go for it, then come back. I'm not quite sure right now how your translational conferences will work, but then again, just let us know ahead of time. Email both me and Megan so that we know when you're supposed to be out. And if you're all groups of 3, it doesn't have to be from each one of you. If one of you emails us, that's enough, and we'll just kind of include your group in the email so that we tell you that you're okay. Before we knew. So if you had Lisa, you're asking if you had patients. You are not allowed to see the patient. You would have to reschedule. I know they're putting in the blocks a little bit later, but unfortunately seeing patients is not an excuse. The only 2 are exams or TRCs. Once you're there, this is kind of a new thing now in the COVID era. I know all of you have been fitted for either a disposable or a reusable N95. You are responsible to bring in your N95 to the hospital. Maureen, yeah, I see what you're saying, but they're pretty set. If she can get a block switch, she would have to let us know, but she would have to switch the whole week if they already have a patient scheduled. So, Lisa, if it's a huge change for your patient, go ahead for it, but it's going to be difficult if everybody has patients scheduled. Anyways, if that is the case, please contact me. And when you're emailing Mill Boyd, let me know. So as I was saying, you are to wear you're to bring your N95s with you to the hospital, the disposable or the reusable ones. When you're at the hospital at all time, you have to have a mask on. If you feel like you can't wear your N95 at all times, make sure that you at least have a mask when you're walking around or anything. But anytime you're in clinical setting, so you're in the OMS clinic seeing patients with them, or you have to have your N95 on. You want your N95 covered by a disposable surgical mask and a shield. This is the same thing that you would wear to the operating room. So the only exception, and that's why I email, you will get it in the email. If you failed all of the disposable N95s, you're not able to wear the elastomer into the OR. Do we need to? You do not. So you're not going to need to bring the shield. If you have a shield that you love to use, bring it with you. But when you go into the operating room and even in the clinic, they have the masks with the shield on them, so you can wear that on top. But if you feel more comfortable bringing your own, you can do that. Okay, so Maggie, when you go to the hospital block, it's you have to report to the oral surgery clinic. It's on the ground floor of the hospital. So if you go through the main entrance, and there's the check-in and there's the outpatient check-in, and you can see ABP. It'll be on your left. Go as if you're going into the check-in area. There are blue elevators on the right side. Just go down to the ground floor, and when you step out of the elevator, you're right there at the clinic, and they will expect you there at 7 a.m. So you can just knock on the door, and one of the residents would let you in. Will you receive an email the week prior? Yes. So as Maureen is saying, that you will receive an email prior with all the directions. Back to, if you have the reusable elastomer, please let us know, because you cannot wear them in the operating room. So for those of you who don't have a disposable, we're going to have to arrange for you to get a PAPR, so that you would just wear a surgical mask and a PAPR. These are very limited, so we need to know ahead of time so that we can plan for it. So I need you to not just only email me, but to also include Megan on the email. Okay? Each day when you go in, so as I said, the week before your rotation, Maureen will send out the details again of where to go and how to get there, where to get your scrubs from, and some forms that you will have to print out and bring in with you. Every day you're expected to be there at 7 a.m. and you'll go through rounds with the team, and then based on what the surgeries that they have going, you would be split up into either being in clinic or in the surgeries. Because of COVID, they're limiting the number of people that can be in the OR. So it used to be that all three of the dental students can be in one case. That's not going to be the case. You're going to be spread out. Most of the time they have more than one case going on, so you're still going to get a good experience. It's going to be more spread out for you. Make sure to pick up your scrubs the Friday afternoon before your rotation. So you start on Monday, the Friday before you have to go grab your scrubs. If you are not able for any reason, like you have your patient, or I had somebody email me saying that they have an assist scheduled, absolutely finish what you have to do, email us, and I can help coordinate with Megan for you to get it earlier in the day. It's a little tough to try to go get it at 7 a.m. in the morning when they're preparing to go out for their rounds. And you have to make sure that you return these scrubs for them at the end of the week. So this is majorly what I have for the hospital rotation. Any questions? Anything that you guys are not clear on? Okay. So the next portion, I'm just kind of giving you a brief glimpse of what you're going to get from this course. So as you've had your basic oral surgery courses with Dr. Itzik, where you learn how to, what are the different instruments and how you do the extractions, or what elevators and forceps you're going to use, what medical complications these patients can have. And now you're starting your clinic, so you're going to be on the OS block, and you're going to start slowly doing more and more of the dental surgery, the dental alveolar surgeries. The goal of this course is kind of to open your eyes and show you other stuff, introduce you to way more advanced areas of oral surgery. The idea is also to kind of help you recognize the cases that you shouldn't really be involved in, or you should know to identify right away and send off to the hospital. For example, we're going to start your lecture that will be up hopefully soon for next week is infections, and Dr. Shahada is covering that. So if you look at those couple of pictures, we think, oh, it's a swollen tooth. Let's take it out, which is true. Let's take it out. But then there are certain circumstances that it's not just simply taking it out. When infection is spreading to different spaces, they can pose a really high risk of complications or even deaths. I'm sure you guys saw on the news, a few years ago, little girl dies from a tooth infection or something like that. It's because the little minor dental infection that was just kind of left to brew got so out of hand that now it involved multiple facial spaces and led to sepsis and death. So he will go over with you in detail how to diagnose, how to know what areas are going to go to which spaces, and how these are properly managed. You'll also hear from Dr. Everett. He'll talk to you about management of the complex impacted teeth that usually you're gonna have, the way that you'll be exposed to is when you're doing some ortho and you have really, for example, this pan that I have for you, who thinks that these canines are pretty easy to take out? They're, yeah, there's a little baby tooth left there, looks pretty straightforward. He will show you how not so straightforward it is and how these are managed. And maybe you'll realize that this is something that you love to do and now decide to go to do oral surgery. You'll get to see more advanced stuff such as cleft lip and palate. Dr. Kakamis, who's an amazing surgeon who specializes mostly in management of cleft lip and palate. He'll go over basically the embryology and what causes a patient to develop cleft lip and palate. He'll show you the surgeries that they go through, the long-term care that is required for those patients. So you'll get exposed to that aspect of OMFS. So we kind of early in your career, as you're trying to learn your skill, you have all of your third year and then all of next year to kind of hone your skill. These are things that you would never just encounter easily in your dental school. This is what you would need to go and get further training for. So the whole point of our course is to kind of open your eyes and show you what other things go on and what other things you can do. The chief residents, Dr. Wilkin and Emmerling, will talk to you about orthognathic surgery. I know that in your ortho courses, you go through all of the orthodontic work and prep that is needed prior to getting to these surgeries. You're going to hear from them of how these patients are evaluated, how they decide on how to, what advancement do they need it in one jaw, do they need two jaws, all of that detail they will go over with you. You'll hear from Dr. Warburton about temporomandibular joint disorder. He will give you 2 lectures. One that is kind of telling you how to diagnose temporomandibular disorders and in what patients are actually good candidates for surgical management. And then the second lecture would really go into the surgical treatment of those patients. When I started my dental training, joint replacements were basically something that was not highly recommended. Now they're pretty commonplace and they relieve patients from years and years of pain. I will give you 2 lectures. And I believe one of them is early on, and I'm hoping that they're going to help you as you're now getting ready for seeing your patients and preparing your patients for prostheses. Whether you have a patient, like you can see in the top photo, with a huge epilis festratum, when do you manage it? How do you manage it? How do you identify it? We'll talk about tori removal. How do you do it? When do you want to do it? When can you avoid it? What are the pros and cons of it? So that's going to be one lecture of just going into the pre-prosthetic, I don't want to say removable, but mostly for removable prosthetics. And then I will have a full lecture for you on implants, how you should be able to diagnose patients, see if you have adequate bone height, how to plan and how to know the 101 of this is how I can get an implant that is restorable and give my patients good aesthetics. I'll go over with you, because I am a prosthodontist, how to make your guides. So if you guys have questions as you're going through your clinic, again, please feel free to come and reach out to me when I'm downstairs with oral surgery. Another big portion of it is going to be oncology. I'm sure you guys already heard about me and how much I love to deal with cancer patients. And you'll see the clerks see a lot of head and neck cancer patients with me. So one of the head and neck fellows, Dr. Bardorma, will lecture you guys on how to biopsy. He's going to tell you, what are the concerning lesions? How do you properly biopsy them? What are the different types of biopsy techniques? Do you want to just take the whole thing out? Do you want to take it and a part of healthy? How do you mark them? And this is we as dentists, all of us should be very comfortable in doing a biopsy of a suspicious lesion and referring our patients accordingly. So this is something it's a really nice lecture. And again, once you review it, and if you have questions, reach out to the faculty. Come downstairs and talk to Dr. Zig and Winter and Everett and everybody there, and ask them how they do their techniques, because this is something extremely important. You'll hear from Dr. Lubeck. Dr. Lubeck will talk to you about those big surgical resections. And while you're on your hospital rotation, you'll probably get to see one of them. These are very long, 6, 7, 8-hour surgeries where it's two head and neck surgeons working together. One is resecting the tumor, whether it's benign or malignant, and the other is harvesting whatever is needed to reconstruct it, whether it's the fibula, scapula, hip. They're pretty intricate and pretty cool surgeries to see, especially when they start doing the microvascular portion of it and you see them working under the microscopes. Make sure that when you're on your rotation, that you make an effort to observe one of those procedures. Dr. Dalaram is going to give you a couple of lectures, one of which is the complications of head and neck radiation, and what, as a dentist, is all of us, our duty to our patients to know and be able to diagnose and manage for those patients. And you'll hear so much more. Dr. Mustafi will talk to you about soft tissue trauma. Dr. Gonzalo will speak to you about also trauma. And Dr. Leventer will give you an insight on hospital rotation or hospital dentistry, and how you can, if this is something that you do enjoy doing, how you can pursue that. So any questions? This is pretty much everything that I have for you. If you guys don't have any questions about the hospital block or the lectures or how you're going to be viewing these lectures, nothing today about it. That's fine. Just let me know. I just want to make sure, one, that not a bunch of you that with elastomeric masks are on one rotation, because that limits your chance of being able to go into the OR. I've asked Miss Boyd to make sure there's only one of you in a group, but I don't know the exact amount. So just contact me with it and I'll take care of it. Would you scroll back to Megan's email? Yes, and I will make sure that you guys, she is going to be away for a couple of weeks. I should have said that too. She's out for the next 2 weeks starting Monday. So make sure that you include me on any email for her. Perfect. And this course really is about you guys enjoying your time, getting a really good experience over at the hospital, and enjoying these lectures. It's a shame that you guys aren't going to have in-person lecture with all these surgeons, because they're amazing world speakers that, every one of them is an authority in their group. Yes, Lauren, you pick up your scrub from the hospital clinic. So that's why for that, you need to make sure that you go when the clinic is, functional. So they usually you're asked to go towards the end of the day on Friday. But if you're not able to, as I said, because you have patients or something, let me know so I can help you coordinate to go in earlier in the day to get the scrubs.